My name is Jeff Brace. I am a prostate cancer survivor, and I was diagnosed with prostate cancer at the age of 60, in fact on my 60th birthday. In relative terms, my cancer diagnosis and my treatment regime was rather easy. The reason for that is it was early diagnosis, and I was involved in a clinical trial where I could be followed as far as how I was progressing and how my PSA was changing. I served for many years in the Canadian Armed Forces, and one of the benefits that comes from being in the Canadian Forces is that you do an annual medical. And since I got out of the Armed Forces, I have continued the practice of having an annual medical. And thankfully, back when I was coming up to my 60th birthday, I had a family doctor that was a very thorough person. She had suspicions about some of the blood work she was doing on me and thought perhaps there was a chance that I might have cancer. She sent me off to be involved in a clinical trial in Kingston, and it's as a result of that clinical trial that my cancer was found very early. And it's as a result of it being caught very early that I was able to go through my cancer experience in a relatively easy way. And I say that cautiously because there is no such thing as an easy way to go through cancer. But in relative terms, compared to some of those who I know and I talk to on a day-to-day basis, mine was an easy diagnosis, an easy treatment regime, and I'm thankful to the surgeons, to the researchers, and to my family doctor for allowing me to be treated so early and so easily. What is equally important is to get your story out, get your circumstance out to your wife, your partner, your family, because you are going to need them beside you as you work your way through this cancer journey. I can't tell you how many times we went for interviews with surgeons and radiologists before we made our decision as to which way we were going to go, and to have someone there in all those meetings with the surgeons and the radiologists, to take notes, to ask questions that you don't think about, or to just write things down is absolutely critical, because although you don't know it, in fact, what you are missing is a lot of the things that are being said to you, and your mind is elsewhere and you're not hearing the good advice you're being given. Throughout my cancer experience, what was missing was the knowledge of what the Canadian Cancer Society had to offer in the way of support to someone diagnosed with this disease. My wife and I spent many hours sitting around the kitchen table discussing various options, when in fact out there is a Canadian Cancer Society with experts who can tell you what is going to happen to you and what you can expect as far as putting up with the disease. Obviously, with cancer being the disease that it is and it affecting so many Canadians, I too had friends who had been diagnosed with the same kind of cancer that I had, and they were always there to support me and offer advice and tell me what had happened to them and their experience in going through with their prostate cancer. The advice I received when I was going through my cancer experience came from friends and associates who had been through what I was likely to go through, which in the final analysis was an operation. And I talked about peer support, and I can't overemphasize the importance of peer support to somebody that is going through the emotional upheaval of a cancer diagnosis. If I had to recommend one thing that was perhaps the most important thing. It is, when you're diagnosed with cancer, please keep in mind that the Cancer Society has available to you support services that will help you dramatically get through the weeks and months that are to follow in your cancer journey. I attended a Relay for Life the year following my cancer operation, and it was there that I got to meet people who enticed me into working as a volunteer with the Canadian Cancer Society. And it was then, and only then really, that I found out what things are available through the Canadian Cancer Society to help people diagnosed with this disease. I have, since that time, worked primarily in advocacy and in peer support. And it's in peer support that I find my comfort zone, because this gives me a chance to talk to people who have been diagnosed with my same type of cancer, and I'm able to help them, and that in fact has been truly rewarding. There are several myths out there about prostate cancer. We've heard doctors talk about whether or not you should start doing PSA tests at certain ages in your life. I guess as a survivor, my point would be that it's never really too early, within reason, to have your PSA test and to have that done on a regular basis after your baseline first year has been established. Another myth is that biopsies are a terrible thing to undergo. And what I say to that is, it is not. Perhaps somewhat embarrassing, but there is no pain, and it's not something that a man should worry about. If a PSA is showing an elevated number and you are required to go for a biopsy, please don't let that dissuade you. Go have the biopsy done. That is the way to confirm whether or not you do have cancer. Harkening back to when I was diagnosed with my cancer, and I had to go to the hospital to hear from the surgeon that I had in fact been diagnosed with cancer, it was a very difficult time. Jaw-dropping would be the way that I perhaps would describe it. But once I was over that first diagnosis, and I had the opportunity to drive 60 miles home to meet my wife, I did a lot of thinking. But what I did was to sit down at the kitchen table and to tell her, and then to pass that information along to my kids so that everybody up front knew exactly what I was facing and what we were facing as a family, because cancer is certainly something that is more than just the individual that's been diagnosed. It's a whole family matter.